Well, I'm O.P. Yadav. I'm the Chief Cardiac Surgeon and the Chief Executive Officer of the National Heart Institute in New Delhi. Bypass is a major surgery, and certainly there are complications, both serious as well as minor ones. The complication rates in literature depend on whether the study has been a retrospective study or a prospective study. Obviously, in a retrospective study, the complication rates are underreported. In general, I would say serious complications occur in about 3 to 4% of patients, and they would be in form of a stroke or deep sternal wound infection or life-threatening tachyarrhythmias. However, certain other complications in terms of GI bleed may occur in prospective studies in up to 8 to 10% of patients, and then you may have complications like renal failure, which may be temporary and may respond to conservative management, or superficial infections, lung infections, pleural effusion, and such other complications.